Chilling calls chronicle a crisis.
Custer County 911.
Brother Hunter took out room 202.
What is wrong with your girlfriend?
He was not responding.
Drug overdoses.
She's not responding?
No, ma'am.
Okay, is she breathing?
Killing more than 250 Americans on average every single day.
911. Are you ready to come to my house? I came home and my parents are not waking up.
About 75% of drug overdose deaths involve opioids like fentanyl.
Don't hang up.
Oh, Lord Jesus. Go.
These are just 2 calls from one South Carolina county over a 24-hour period. On that day, 11 people overdosed, and 4 of them died. Now there's an innovative solution taking shape across the country.
Reporter Heather Graf has this new approach in hopes of saving lives.
You'll find them outside fire stations in Washington, D.C. This one sitting right next to a typical vending machine that dispenses drinks. But before we explain what makes it so different, let's first take a look at how we got here.
I've been doing this work for 30 years.
Angela Fullwood Wood runs a nonprofit, federally qualified health center known as Family and Medical Counseling Service Incorporated.
We provide a comprehensive harm reduction program. And so for us, that program includes syringe exchange services. It includes the distribution of Narcan, of fentanyl test strips. It also includes linking people to medication-assisted treatment if they're interested in starting to decrease their level of use.
She feels those resources are critical, especially after D.C. saw 448 opioid-related fatal overdoses in 2022, 96% of those involving fentanyl.
We're very scared. We're afraid, that the death rates will continue to go up.
So as the opioid and overdose crisis evolves, Angela knows their response must evolve too. And she says the so-called harm reduction vending machines are a new tool intended to provide low-barrier access to potentially life-saving supplies.
And I think that everybody is not ready to walk into a traditional health environment and ask for Narcan. We see it as one more strategy to get Narcan to the residents to keep them safe.
Through a partnership with the D.C. Health Department, Angela's organization placed the vending machines in neighborhoods with some of the city's highest overdose rates and then stocked them strategically.
With
the opioid overdose reversal medication Narcan, plus fentanyl test strips, and other items focused on health and wellness.
We include male condoms, female condoms, hygiene kits, Band-Aids, COVID test kits.
All of it funded largely by government grant money and available for free, anonymously, and 24/7 to D.C. residents.
Once you call that number and press the number 3, it will give you an access code that would allow you to dispense items from the machine.
When we met Angela, they were just about 1 week into this year-long pilot program.
We vended about 95 items thus far.
95 items in about a week's time.
Right.
How significant is that to you?
I think it's very significant. I mean, I think, it's a pilot program, and when you start a pilot program, the one thing you don't know is if it's going to work, or if the interest is going to be there. I think the early interest tells us that there is a need in the community.
And it's not just here in the nation's capital. In recent years, we've seen the harm reduction vending machines rolled out in several states, including Michigan, Missouri, New York, Wisconsin, Illinois, and Ohio.
The first machine ever in the United States was in Puerto Rico in 2009. Then Las Vegas had a machine in 2017, I believe, is when they installed theirs.
That's Daniel Arendt, an assistant professor and doctor of pharmacy at the University of Cincinnati, who's been studying harm reduction vending machines since this one deployed in his city back in February of 2021.
And then Cincinnati was the second metro area in the continental U.S. to have a machine.
Cincinnati's was set up by a nonprofit called Caracal, and similar to the vending machines in D.C., it's filled with a variety of harm reduction products, dispensing 3,360 doses of Narcan and 10,155 fentanyl test strips in just the first year.
We directly compared how much distribution of naloxone, fentanyl test strips, and things like that were given out through the Caracol organization the year prior to the vending machine and then the year of the vending machine. And we saw drastic increases.
And by year 2, Arons says periodic surveys of the people using this vending machine led to another eye-opening number.
We've already had over 1,600 overdoses reported to have been reversed in our patient population specifically.
This, says preliminary data from the county where Cincinnati is located, shows overdose deaths there dropped 16% from 515 in 2021 to 433 in 2022. Do you think this machine is saving lives then?
I do not know what proportion of them have been saved by this vending machine, but what we can say overall is that through detecting fentanyl and through having overdose reversal agents around, lives have been saved as a direct result of the vending machine.
Ultimately, Arons' research, published in the Journal of the American Pharmacists Association, concluded that the harm reduction vending machine in Cincinnati has had a sizable impact.
This was more effective than we even really anticipated it being.
And though Angela, back in Washington, D.C., was not surprised by that assessment,
It makes sense to me.
she is encouraged and believes even more cities and states could soon follow suit.
I know that it's picking up nationally. We do participate in national calls around this. I think the sky's the limit in terms of where you can put them based on what's happening in your community.
In D.C., you saw the harm reduction machines are set up outside fire stations. They say that's to try and help with oversight and prevent vandalism. We're told the machines also have technology built in that can regulate temperature and monitor inventory levels. It keeps track of product expiration dates and alerts staff when any action is needed.